stroke coordinator. I'm going to try and clip this on here. Hopefully this will work. I'm the stroke coordinator for the program at this hospital. Can you hear me at the back? Turn it where? Yell. Okay, sure. Yeah. Okay, let's clip here. I need a course and mics. Try it up here, maybe. I'm just going to tell you quickly about our program a little bit, and then I'm going to hand over to Jill, the nurse practitioner for the stroke program. So we are a comprehensive stroke center, so all of you are lucky that you live near a comprehensive stroke center. There's only 5, we have national comprehensive, there's only 5 in the state of Florida currently, and we just got ours in April, which we're really proud of. We have to go to a rigorous survey to get that, and so it's good to know that we are one of the best stroke centers in the country. So we got that because we offer the highest standards of stroke care here, from when you're diagnosed to your treatment. We have up-to-date research. We have a new rehab center. Well, we have an excellent stroke rehab center, and we're building a new stroke rehab center coming up in 2016. We offer a wide spectrum of therapeutic possibilities for all types of strokes. So regardless of whatever kind of a stroke you come in with, we have the most up-to-date advances and technologies here, and we constantly are striving to make sure that we're up-to-date on everything. We're also a referral center for other stroke-ready and primary stroke centers, so we get referrals in from the other centers around here too. So we have a variety of experts and a lot of disciplines that work together, and I try and work with all of them and coordinate to make sure that anybody that comes in here with a stroke gets the best possible outcome. For someone like Susan in this video, we work with them, we can work with them from the time they come in to when they go home and to their room, and even afterwards, to make sure that we're offering the best possible care that we can, and she's going to have that best outcome when she leaves the hospital. We've been very fortunate. We've been certified since 2005 and we maintain that certification every 2 years. We've been licensed by the state of Florida. We've achieved many awards from the American Stroke and American Heart Association. And this year we got one of the highest awards, the Target Elite, from the American Stroke Association 2015. And so that means of all the stroke patients that come in, if you need thrombolytic therapy to dissolve that clot, we got that because we give that to more than 75% of our patients within 60 minutes. So we've worked really hard over the last few years to make sure that we're doing that, and it's wonderful to get this award. And then we got our comprehensive stroke certification in 2015 from DNV. And these are some of our measures. You'll see this is patients who received that TPA thrombolytic therapy within 60 minutes. We started off in 2011 at 7%. We've all worked really hard, and as you can see, we've made a great achievement. In 2014, 80% of our patients got that. So we work with EMS. We're aware that if you're having a stroke in the community, that you're coming in. We're waiting at the door for you when you get in the door if anyone we know is having a stroke, and then we make sure that time is brain. It's all we're thinking, time is brain, that we are working with that patient as quickly as possible to get the most appropriate treatment. Part of being a comprehensive stroke center is that we have these advanced therapies. One of them is interventional neuroradiology. We have a neurointerventionist, Dr. Case, that works with our program. And so when that patient comes in, who's working with us, a stroke patient comes in, we look at we take the patient immediately to CT scan. We're looking to see if the stroke is an ischemic stroke or is it a hemorrhagic stroke. And he will also be looking at the films with us. Some patients are eligible to go to interventional neuroradiology and have that clot removed, and I'll show you a picture of that. So he's working with us to offer us, to make sure that everybody will get that treatment if they are a candidate for that treatment. So this is an example of a patient that came in, and this is where they had the blockage. It's like going for a cardiac catheterization. We go in through a major artery in the groin, and we go up into the head, not the heart, obviously. And then we have the films, we can look, and he can see that there's a blockage right here. So he'd go in, he has special equipment and he's specially trained, and this is an example of the clot that he can remove. Usually takes about 1 to 2 hours. And then this is an example of the after treatment picture, and you can see we've restored blood flow back into that area of the brain. So we've had amazing results, and it's great that we can do that. Patient will probably also get the thrombolytic, and sometimes that will dissolve the clot, but not always. And if it doesn't, then we're taking them in and we're going to try and see if we can manually remove the clot. So we've had patients that have come in, have had devastating strokes, and they've walked out with no disability because they've been able to have this procedure. So it's not for everybody. It's usually just a major vessel, but it's great to have this option if needed. Dr. Case also can coil aneurysms. You see there's an aneurysm on this picture up here. And so he'll go in again through the groin, and he can insert these coils into the aneurysm. And almost about 70% of aneurysms can now have this done, and it means you don't have to go and have major surgery, where beforehand they would have to go in, do surgery to the head, and then insert these coils. Now, with having Dr. Case here, we can do that procedure right here. He can fill it up with coils, which stop the bleeding, and then the patient is kept here maybe a week or 2 weeks, and then they can go home without having had that major surgery. So this is just an example of some of the interventions that we offer as being part of a comprehensive stroke center. Any questions for me on the program before I hand over to Jill?
I had a stroke 12 years ago, and when I got to the hospital, it was on a Sunday, so I'm going to ask you about your weekend coverage. It was on a Sunday, and it was an hour before they could get someone even in to do the CAT scan on my brain, and so time was just clicking by. What is your coverage on the weekend? Do you have those? I understand on a weekday what all this coverage. Do you have that 24 hours a day?
We have it 365 days a year, 24 hours a day.
Excellent.
And it can, yes, and we make sure that
really important.
Dr. Case has somebody come in from out of town when he goes on vacation, or if he needs a weekend off, like we had someone cover last weekend. So we always can maintain that. Otherwise, we cannot be a comprehensive stroke center. 24 hours for MRI and for CAT scan. So regardless of the day that you come in, we have a neurologist, neurosurgeon. We always have a team here. So that's a great question. And I'm going to hand you over now to Jill Garrett, who's our nurse practitioner, who's going to talk about stroke risk factors.